beginning of a move in the United States toward what's being termed as the fifth wave of public health. And the fifth wave of public health really has more emphasis on culture at the bottom of the list. Some people are calling it the culture, the fifth wave, the culture of health. Robert Wood Johnson Foundation has been doing really, really important work across the past decade on defining this idea of a culture of health. Even though, even if we have all these things, culture impacts our behaviors individually and collectively very significantly. I might know that eating fried chicken is, fried foods is not the best thing for me. I'm relatively intelligent, I have that information, it's widely known, but I live here in the South, and like the bluegill just rocks the fried chicken, right? And we eat fried chicken. I get together with people, and that, so decisions aren't just about what we know and what we think, right? They're motivated by culture, collectively and individually.
For those of you that work in an academic setting, I'm sure that you read and write a lot of academic papers that are published in peer-reviewed journals, and that's an important part of being an academic. But I don't know about you, but they're not always the most interesting to read, and they're also not always the most moving things to read. They also have a very narrow audience. And so there's a lot of work that's being done now looking at different ways of disseminating research findings using the arts. I can talk about that for a long time, but I'm not going to. I'm going to give you one example. And I picked this example because we have some people with us who have connections to Puerto Rico, so I thought it was a good one. This is a graphic novel that was just published like a week ago by a researcher, Dr. Gemma Su, from the University of Manchester, and it's about Hurricane Maria in Puerto Rico. And she went in and did ethnographic social science research with communities about their experience during Hurricane Maria.
So at its core, at the definition level, health communication is communication strategies that are focused on making evidence, so making things we know interpretable, persuasive, and actionable. This is kind of the norm, or has been the norm in health communication, right? We expect to get a brochure when we go to the doctor's office or the health department, and this is kind of the low-hanging fruit in health communication. What do you think the comprehension is of these sorts of materials? 7%. You guys are radical pessimists.
Oh, wow.
This accounts for the people who actually read it, right? So how many of us actually read these brochures? Now you're right, 7, 20, 25, right? But what is beginning to happen in really exciting ways is some cross-sectoral collaboration between the arts and public health. And as I say that, I want to acknowledge that this is not new, right? These ideas are not new. Throughout our human history, the arts have been used as a form of communication. We started with our theoretical foundations last week, looking at the ways the arts are used to reach people, to influence behaviors, right? Percy Shelley again, poets are the unacknowledged legislators of our times, because the arts are powerful means of communication. And I'm very excited to see examples of this. Not only, again, there's never been an absence of these intersections, but it's that in the United States we're just beginning to recognize, like we did recognize 30 years ago, we began to recognize that the arts have a place in healthcare. Today that's beginning to happen in public health. And I'll talk more about what's happening in that space, but I want to give you a really awesome example. So who knew, someone rumbled when I said East Los High. You know this show?
Yeah, I mean, I have a Hulu subscription, and there used to be advertisements for it.
Good. It's a great show. So East Los High is a telenovela. It's a television drama, 7 seasons on Hulu. Millions of people have watched it, super popular. And it was a partnership between arts, television producers, artists, and public health professionals. Wise Entertainment, who produces this show, half of their staff are public health experts. So it's a really gorgeous collaboration. So first, the analytics. 55% of viewers watched the entire series more than once. 87% viewed the transmedia extensions, the blogs and all those things. That's a lot, right? That is a different way of viewing television. This part is super cool. Over 30,000, almost 31,000 Planned Parenthood visits were scheduled through the program's website. 52% of those were new visits. So people are watching the show and making their appointment, right? They are changing their lives right there while they're watching the show. So the partnership with public health, again, is key and central. It's a great show, clearly 5-star rating among those surveyed. High level of identification with characters. A lot of the narrative that came around like this is, I've never seen someone who looks like me on a television show, starring in a television show, and this is my neighborhood, these are my people. So that level of individual and cultural identification was very, very high. 86% said they're likely to adopt emergency contraception, 93% that they would recommend it to others. Again, very high intent for behavior change. 98% said they're likely to use condoms correctly, right? Learning and intention. 91% said they're likely to use them every time they have sex. So these are really significant impacts. But I'm now going to show you what happened in Liberia. And want to preface this by saying we take zero credit for it. Our work didn't influence this at all. So this is what happened in Liberia on its own, and then I'll tell you what our work did do, how it did come into this space. So in Liberia, as I mentioned, people really felt that this was a government conspiracy, and so they weren't interested in listening to those health providers. So this guy, Shadow, and his musical partner, D12, who live in Freetown, Liberia, happened to be in the United States touring. Right then in the beginning of May when I got back and was yelling at my radio. And literally, one of those same weeks, they were feeling the same thing. They were frustrated that people weren't listening to health officials and that there was no relief and it was just skyrocketing. At that time, as a matter of fact, the projections were that if that curve didn't change, by January there would be over 2 million cases. So we were freaking out as a world, right, around Ebola. So Shadow and D12, that night after dinner, hunker down with their little audio recorder at home, and they write a song called Ebola's in Town. And they email it that night to their DJ friends and dance hall DJ and radio DJ friends, and within a week it tops the charts in Liberia, and everybody's listening to this song. So what happened from that is that UNICEF, the World Health Organization, these agencies that were working on behalf of Ebola noticed that this song was playing everywhere. And they're like, hey, this is a vehicle for communication. The second song that hit the charts was called Ebola is Real, to counter the conspiracy theory. And again, there's a solidarity between artists and us, citizens, that's different than citizens and public health officials, right? So right away, the solidarity of communication helps. These are trusted people who are saying these things. And when you partner, like Wise Entertainment does, public health professionals and artists, what you can get as a mechanism for communication can be very powerful. So I want to wrap up by just giving you a little bit of information about this national initiative that you've heard a bit about. So as I mentioned, the time has seemed to be right for the arts, public health, and community development to come together. So we're leading this national initiative in partnership with and with funding from Art Place America. And it's all about building out the intersections of arts and public health and community development in the context of place, understanding the significance of place in relation to health, culture, and the arts. In a few minutes. Thanks to our guests for joining us today.